Welcome all of you to this live program at Orthopedic Principles. Today our guest of honor is Professor Young-Lae from South Korea, Professor of Chosun University since 2010. He has been the president of the Korean Shoulder Elbow Society during 2017 to 2018. And Professor Moon is also the vice chair of the Medical 3D Applications Work Group, directorial committee member of the Korean Stem Cell and Regenerative Medicine Society, as well as the Korean Sports Medicine Society. If you notice, Professor Moon has delivered a lecture on a channel which has already reached a huge audience, and today is my great honor to bring back Professor Young-Lae Moon for this wonderful live program.
Thank you, Professor Hiteshi Goplan. Good day, everyone. Today, I'll discussing how recent biologic and mechanical innovation, including Regeneten, PRP, and BioBrace, are transforming landscape of rotator cuff surgery, improving healing quality and clinical outcomes. Today, presentation will cover three main topics. First, I'll briefly review rotator cuff tear and repair. Second, I will discuss PRP and its clinical application. Finally, I will introduce bioinductive patches focusing on Regeneten and BioBrace as the latest biologic and mechanical augmentation technologies. As people age, rotator cuff tears are becoming more common and are a major source of chronic shoulder pain. Since this is the degenerative process, the damage usually worsens over time instead of healing. And in some cases, it can cause instability and arthritis in the shoulder joint. In some cases, we can achieve excellent outcome through various rotator cuff repair techniques. Nevertheless, even among patients with similar condition, different levels of post-operative stability have been observed. Over time, high chance of retear 10 to 80% has remained in painful reality for both patient and shoulder surgeons. Furthermore, long recovery time after surgery remains significant challenge for both patient and surgeons. Therefore, both biologic healing and mechanical stability are essential for successful rotator cuff repair. The key requirements for emerging technology in rotator cuff repair include stronger biologic healing at the tendon bone interface and reduction in retear site and faster overall recovery period. Therefore, several innovation solutions, including PRP, Regeneten, and BioBrace, have been developed and are now actively used in clinical practice. The first topic is PRP for cuff repair. We have performed around 500 cases to date. In our hospital, PRP from autologous peripheral blood is combined with bone marrow aspirate concentrate, BMAP. This combination takes advantage of the synergistic bioactive factors from both sources of enhanced healing. PRP enhances extracellular matrix production, neovascularization, and tendon bone healing. Since September 2022 to till now, intraoperative PRP was used 500 rotator cuff repair cases. This scene demonstrates the application at the finally prepared PRP into rotator cuff repair site. In large rotator cuff tears, PRP significantly reduced the retear rate 4% compared to 20% in control group at 24 months. Also showed better early pain reduction and improved functional outcome reported by Pandy et al. In JSCS. For better physical stability, we injected material can also be applied in a gel form. This scene demonstrates the insertion of platelet-rich fibrin gel during rotator cuff repair. According to Duncan et al. 2019, arthroscopic augmentation using autologous platelet-rich fibrin gel resulted in significant pain and functional improvement at 3 months and promote faster rehabilitation. Now, we'll move on to the next section, focusing on Regeneten. Between October 2024 and till now, 220 cases Regeneten Bioinductive patch procedures are performed in our hospital. According to Sugar et al. 2020, the Regeneten Bioinductive implant showed early pain reduction from just 2 weeks after surgery, significant functional improvement, and remarkably low repair rate. 1% compared with 26% in the control group. Warren et al. 2025, the use of Regeneten in full thickness cup tear resulted in significant pain reduction, improved functional outcome, and notably low repair rate, 8% compared to 26% in control group. This is a surgical scene demonstrates the fixation process of the Regeneten patch. Typically, 4 observable staples are inserted and secure the patch to the medial portion of the rotator cuff. 1. After that, 2 to 3 peak bone staples are applied to the fixed patch to the bone. Finally, additional observable staples are placed as needed for reinforcement, completing the procedure. This is 58-year-old female patient with full thickness rotator cuff tears. Intraoperative finding confirmed, successfully repaired, and MRI obtained 1 week post-operatively demonstrate the tendon well covered with repair site. This is patient with large rotator cuff tear. The surgical finding shows good repair, and post-operative MRI confirmed tendon coverage at the repair site. This is Regeneten. Despite of being massive tear, Regeneten provides strong biologic induction, allowing solid tendon integration. At 3 months post-operative MRI, we can clearly see early biologic healing with well-incorporative footprint. Even large tear can achieve successful healing with augmentation technologies. Even in repair, Regeneten augmentation demonstrates progressively increase in tendon thickness from preoperative imaging into 1 and 6 week post-operatively. Serial MRI scan shows gradually signal normalization, indicating not just mechanical coverage but also providing bioinductive healing response. Regeneten provides both biologic and mechanical advantages by inducing favorable healing environment and reinforcing the repair site. It's not only enhance tendon integration but also promote true regenerative remodeling. This combined effect translates into improved healing quality and consistently better clinical outcome, even in challenging cases such as massive and tears. BioBrace is expected to be available in Korea starting this October 20th. This implant, combined with biologic induction seen in the Regeneten, and add early mechanical stability through resolvable PLLA scaffold by providing both biologic stimulation and structural reinforcement. BioBrace is designed to enhance tendon healing quality while improving initial fixation strength, particularly large compromised tears. With BioBrace, patients not only experience reduced retear but also gain an advantage of initiating functional activity much earlier thanks to combination of biologic stimulation and early mechanical support. In summary, PRP provides early pain control and contribute to reducing retear risk, regenerate and promote biologic tendon regeneration, and accelerate functional recovery. BioBrace, by combining mechanical reinforcement with biologic stimulation, delivers a more balanced and durable healing response. Together, these strategies reflect the evolution from simple repair to the true biologic and mechanical augmentation in rotator cuff surgery. Thank you.
Thank you, Professor, for this crisp presentation. And just a few questions. Is there enough level 1 data to say that the Regeneten offers superior outcomes compared to just repair alone?
Yes, it is weak point of these studies. You are right. So it requires randomized control study for the patient. Still, lots of the institute tried such a study. So as a practitioner, I clearly bet the result would be at least better. I cannot say it would be best choice, but at least could be more good choice than previous simple repair procedure, even though it requires something cost procedure.
And what is your take on PRP for a conservative treatment? If you're doing non-surgical treatment, what is your take on PRP?
Yes, the major effectiveness of PRP would be provide anti-inflammatory effect, additionally promote vascularity and healing mechanism. So in case of the stiffness or minor rotator cuff tear, and if patient do not want surgery, even there has an obvious rotator cuff tear, in such a case, only PRP injection in outpatient clinic also provides sufficient result.
Do you use in your practice PRP?
Yes, more than several thousand cases. Yes.
Okay. What is your take on massive rotator cuff tears? Large tears, massive tears which are irreparable. What is your solution? Or do you go for muscle transfers or do you for superior capsular reconstruction? What is your take?
In case of massive or large cup tear, I am divided into two parts. The one, patient can functionally elevate his or her arm properly. In such a case, I try to partial repair or patch graft or the repair and augmented with BioBrace or Regeneten. So I try to repair as much I can. If the patient cannot available for abduction properly, it is keep going. Maybe I try to wait at least 1 or 2 months. If patient is still unable to moving arm properly, then I comment is let's go for the reversible surgery, arthroplasty.
You prefer arthroplasty.
Yes.
And what is your take on the lower trapezius transfer? There's a lot of interest in lower trapezius transfer, right?
I know that some surgeons prefer such a procedure, but some surgeons criticizing a little aggressive surgeries because trapezius muscle is not only useful for scapular movement, but also useful for breathing.
And there are some, Dr. Park from Korea also did the long biceps tendon.
Yes, Dr. Park and lots of doctors like this procedure utilizing biceps rerouting.
They use
Yes,
the biceps as a cable, right?
function in aged person, flexion and extension is dependent on the short head of biceps. So long head of biceps can be utilized as supporting rotator cuff tendons. So it's a smart idea.
Thank you, Professor. Thank you for this wonderful presentation. Great discussion.
Thank you.